Hi, everybody. Thank you for joining us tonight or this morning. It feels like night for me. I'm on a night shift ER doc where it's Straub. Just wanted to thank Claire and a lot of the healthcare providers here for joining us, as well as educators and other people interested in learning about kind of the updates. Claire's done a tremendous job. I think she's presented maybe 7 or 8 times now for Rotary in our district here. And every presentation she does, she adds more. She adds updates, and I'm really excited to kind of hear her talk here again. I guarantee things have probably improved and changed since we last heard her. And again, just very phenomenal. She's actually a coworker of my wife. Wife's actually at the Straub urgent care and walk-in clinics. She's dual board certified in Canada as well as the United States in family medicine. And she has a tremendous amount of experience, not only in community local medicine, in the States and in Canada, but also abroad and internationally. She's I don't know how many continents, maybe 3 or 4 continents at least. She's practiced medicine and just has a world view of it. And I think having someone like that bring that experience to us here in Hawaii and also explain how this relates to us is going to be a great talk. I'm looking forward to how she's going to articulate this to us. And again, without further ado, Claire, thank you again for this opportunity again to learn and listen in on the updates. Thank you.
Okay, well, thank you very much, James. Am I unmuted? Hello?
I can hear you.
You're good.
Yes, we can hear you, Claire.
Okay, good. And so what I'd like to do is speak for about 25 minutes, and then we will take question and answers. We've got some great members of our new health committee for the Rotary Club Hawaii who are very experienced and can help with this as well. So I just wanted to highlight a few things about COVID-19, talk a little bit about the new variants, talk a little bit about some of the treatments that are available, and of course, deal with some of the issues around vaccination. Okay. So just to start, I just wanted to get everybody on board. The disease is COVID-19 caused by the RNA virus SARS-CoV-2. And the RNA virus is a piece of genetic material that is encapsulated with a protein core, and these spike proteins on the end is what a lot of our therapeutics and our vaccines are directed against. And within that genetic code is the spike protein gene code that has been very important in our vaccines. Common symptoms are fever, dry cough, shortness of breath, and fatigue. However, what's unique to COVID is this loss of taste, loss of smell, but the symptoms can be pretty much anything from headache to muscle aches to nausea and vomiting, diarrhea. And in the younger crowd, the children, they often present more with the nausea, vomiting, diarrhea, and older people tend to do more with the dry cough, shortness of breath. We inhale the respiratory, the virus through aerosolized particles and droplets, and it replicates in our lungs, causing first potentially pneumonia for more serious disease, and then a huge inflammatory process that makes people severely ill. Just to compare the flu to COVID-19, just a comment, the flu has virtually disappeared in Hawaii this year because of our masking and social distancing. But the flu, of course, when someone is infected with the flu, they generally transmit it to one other individual. The difference with COVID is that one individual who has COVID can transmit it to 2, and with the new variants, 3 other individuals. So it spreads much more rapidly. The other thing about the flu is that when you are in contact with someone, within 4 days, you generally come down with symptoms. The challenge with COVID has been that when you are in contact with someone with COVID, the virus can be replicating in your lung tissue, but you may not get symptoms until 14 days out, 2 weeks later. And in this time, you are continuing to spread that virus to others without being aware. There's a much higher hospitalization rate and a higher death rate from COVID. The other part of COVID is that the infectious period where you're spreading virus can start 2 days prior to the appearance of symptoms. Generally, the illness lasts for 10 days, and most people clear it at that point. But it's the spreading before you're even aware you're symptomatic that is the concerning part. And as I say, that can be upwards of 14 days out from exposure. If you're going to get severely ill, it's usually around 9 days after the symptoms start. And then the other unique thing about COVID is these long haulers. These are individuals who are infected, they clear the virus, but a month out, 2-3 months out, they're still having severe symptoms, fatigue, cough, breathlessness. I had a 32-year-old nurse who came in to see me. She was 3 months out. She had previously been running 4 miles many times a week, and she was not able to return to work because of her severe fatigue, and she was not able to walk a block because of the breathlessness she experienced. So although the long haulers are often seen with older age and more serious underlying disease, it can also occur with mild illness. So this is one of the reasons they say you do not want this disease, because you do not know if you're going to be a long hauler. But the good news is 98-99% survival rate from COVID. 80% of people have mild to moderate symptoms, 20% end up hospitalized. And with the new therapeutics and treatment, it's about a 1% mortality rate at this point. Those who have no symptoms at all are considered 15 to 20% have no symptoms. And these are individuals who can spread it. The milder symptoms can be seen in children. And again, these can be people who spread the virus without being aware. The other thing is within a household, if someone has COVID-19 and is in a household, it's really hard to prevent it spreading to other members of the household. And they're just 25 to 50% can be spread within that contained environment. Now, in terms of the mortality rate or the number of deaths, definitely the older age group are the ones who are most affected. And that's why the targeting of the vaccine to prevent death in this age group. 80-year-olds, there's a 15% mortality rate, 70 to 79, 8%. However, the spreaders in the United States right now are in the age group 20 to 40. And so even though there's less mortality as a percentage, when it spreads wildly within this group, you are still going to get deaths in that group. Certainly, having an underlying chronic illness increases the risk of severe disease, and 94% of COVID deaths, people have at least one comorbidity. Age, we've talked about, but obesity, diabetes, hypertension, lung or heart disease all increase the risk of severe illness. Race also makes a difference. And this is a slide, it's a little complicated. It compares the rates of the number of cases, number of hospitalizations and deaths compared to a white Caucasian individual. So as you can see, in terms of cases, there's less cases in the Asian population versus those of different. So 1 would be the rate of a white person. So 0.6 is less than 1. In the Native population, African-American or Hispanic, there's a higher number of cases. There is definitely a higher number of hospitalizations, and the death rate compared to 1.0 for a white person is much higher. And this is not only genetic, it also has social economic factors. These individuals may be more likely to be essential workers out being more exposed to the virus. They may have more comorbid illnesses because of lack of access to healthcare. And this is also translated in Hawaii, where our non-Hawaiian Pacific Islanders from the South Pacific. They represent 4% of the Hawaiian population, but account for 30% of cases and 16% of deaths. So let's talk a little bit about treatments. So as I said, most people do recover even with underlying comorbid disease. But what happens usually when the symptoms start is that day 5, the cough and fever start to ramp up. By day 8, this is when 20% of people will go on to a COVID pneumonia, a serious lung infection. And often these people will need hospitalization and support. Most of these people recover. 5% will go on to need ICU support. And that's usually at about 10 to 11 days into the illness. So in terms of our treatments, they are targeted for the various phases of the illness. Vaccines, of course, are meant to stop you from getting the COVID illness entirely. In the early infective stage, where the virus is replicating in our lungs, if we can shut that virus down, there is less hospitalization, less severe illness. And we have some treatments for that time. When we're into the pulmonary pneumonia at day 8, 9, then there are the treatments for this, one of them being remdesivir, which is an antiviral medication that has been borrowed from other viral illnesses like HIV. And this is meant to shut down the virus and has been shown to reduce the length of stay of hospitalization. The other big one is the dexamethasone, which is a very common steroid that we use for croup in kids, very safe, and it has been shown to reduce the death rate in people who get COVID and are hospitalized. And then for those poor individuals who end up in the ICU and are into what we call a cytokine storm, where the whole lung tissue is inflamed, there are interleukins and all kinds of other modalities that are used, as well as oxygenation support for these individuals. Just to mention about the viral replication phase, the first phase of the illness, there is now a treatment called an antibody infusion with monoclonal antibodies that are for non-hospitalized patients with the intent to reduce the risk of hospitalization and severe disease. These are meant for people with underlying comorbidities as listed here. It is IV treatment of antibodies. Many people are familiar with this one, Regeneron, which Donald Trump received when he was first diagnosed with COVID. We are doing this here in Hawaii, and you can certainly reach out to your primary care provider. The intent here is you get this early in your disease, as soon as you are identified as someone with COVID, if you have underlying comorbidities, because it's most effective before the virus starts to replicate. It binds the virus and neutralizes it. In terms of testing, I just wanted to briefly talk about some of the newer tests that are out. The traditional one, the most accurate, is the nuclear genetic test. It takes between 4 and 72 hours to get the report back, and it's been very frustrating for people to the delays in getting their answer back. And so it has its limitations. The antigen test can be a saliva or a swab test. Generally, the results are available in 15 minutes, but it is not as accurate. You can be told that you do not have the COVID virus, but in fact, you may have it. And the reason is, bear with me with this slide. Well, after exposure to the virus starts to replicate. But if you go and test too early on, you are still got the virus, but it's not at a high enough level for our tests to detect that you have it. So for example, if you are tested before you get on a plane and you come back to Hawaii and you're confident that you're negative in terms of your COVID virus, and then you start to develop symptoms and you're like, well, I can't have COVID because I tested negative, but that's not true. This is where a second test 3 to 5 days after exposure or symptom development is needed. Just make sure you truly are not infected. The other new thing that's on is testing to be done at home. This will be very important in the mainland, especially where it's hard to get tests. And these tests are as accurate as the traditional PCR tests. They're cheaper. They cost about $30 at this point. And as we roll this out, hopefully we can use this maybe to test children who are going back to school. And we're still looking for ways in which this will be useful for getting our economy back. So vaccines. There are over 120 vaccines in development. Some of them are the traditional vectors, and then we have our new vaccines. So the types of vaccines that are currently on the verge or are already approved are the traditional vaccine, which is an inactivated virus similar to the polio vaccine. The Chinese Sinovac is one of these, and this is injected into the body and mounts an immune response. The Novavax is taking some of the proteins and inject from the COVID virus and injecting this. This is not as yet approved. It's still in phase 3 trials. Then we go over to what is available here in the United States, and this is the mRNA vaccines, Moderna and Pfizer. And these are a piece of the the RNA that is going to manufacture the spike protein encapsulated into a fat layer. And then the other ones is the Oxford AstraZeneca, the Johnson & Johnson. This is taking a common cold virus called the adenovirus, putting the genetic material inside and injecting that. So those are the currently available vaccines. Just the mechanism of the RNA vaccines. So you've got your spike protein RNA in that lipid shell, injected into the body, into the muscle of the arm, taken up by the cell, goes to the manufacturing part of the cell called the ribosome, which decodes the RNA, and then protein the spike protein is generated and copied and released into the body, and our antibody system and our immune system recognizes this as a foreign invader and mounts antibodies against it and memory cells, so that if we are exposed to COVID, our bodies are primed to neutralize that virus before it infects us. So this is a comparison of the vaccines that are currently available. The Moderna and Pfizer are the RNA viruses requiring 2 vaccines, incredibly effective at preventing the COVID illness, 95%. The challenge, of course, is the cold temperatures required to make sure it's effective, and the cost, $33 a shot, so $66 for the entire vaccine series. The other ones, the Oxford AstraZeneca, Sputnik from Russia, and the Johnson & Johnson, which is now under FDA consideration. Not quite as effective, although the Sputnik has been shown to be 92% effective. The Oxford AstraZeneca and Sputnik require 2 vaccines. And in fact, the first Sputnik vaccine is identical to the Johnson & Johnson. And the advantage of the Johnson & Johnson is the need only for 1 vaccination. 72% of individuals who received the Johnson & Johnson did not get the COVID illness. And the big thing is that even if they were infected, there were 0 hospitalizations, 0 severe disease. And that's what we're trying to do with our vaccines. And quite frankly, that is what most vaccines protective range is 70 to 80% traditionally. It's to shut it down in the communities. The cost is much less for these vaccines, the Oxford AstraZeneca and the Johnson & Johnson. So for our global partners, this will be important. Safety is what people are worried about. How did they make these vaccines so fast? Well, actually, there's been a lot of research and background into this starting in 2005. And it's just because of the funding and the hard work and the warp speed. that we have been able to make these vaccines available within less than a year. And part of the way they've done that is they've sort of did the animal trials and then started the phase 1 trials, which were safety trials in very small numbers of people, and they overlapped. So when they saw that there were no serious side effects, they increased the numbers. And so the phase 2 trials had more numbers. Again, safety was there. So then they started the large numbers of 100,000 people in the phase 3 trials, at the same time providing the funding to start the manufacturing process so that these were being run in parallel. And that's why we got the vaccine so fast. In the COVID trials with Moderna and Pfizer, I just wanted to emphasize there were multiple ethnic groups. It was done in South Africa, Brazil, 100,000 people, many centers, many ages. So they've tried to cover all parties. The RNA vaccines do not contain the virus, so they cannot give you COVID-19. And they do not alter a person's DNA because these vaccines do not enter our genetic material at all, because that was one of my concerns when I first heard about these vaccines. They've been proven to be safe, and there's going to be ongoing monitoring for safety over the next 2 years. In general, in vaccines, if you're going to have a safety problem, it's usually presented in the first 3 months, and we're well past that phase. And the other thing is the RNA is very unstable. That's why you need the ultra cold temperatures. It decays within a few days. So we talked about the fact it's safe in older individuals, strong immunity after the second dose, safe in individuals with underlying diseases. It hasn't been studied in children, although these trials are now underway down to the age of 12 to 16 is now underway. It has not been studied specifically in pregnant women, although pregnant women became pregnant in the trials, and it was considered safe. And that pregnant women are very high risk of severe disease. And so this is a discussion with the woman and the obstetrician. The Society for Obstetrics and Gynecology is supporting immunizing pregnant women. The individuals who were not studied were people with anaphylaxis. This is like people with peanut allergies or people with severe drug allergies who can't breathe and their throat swells up. So these people were not included in the trials. And with some of the vaccines, there have been these incidents in people. There were 21 so far in the individuals who've been vaccinated with the Moderna and Pfizer. And so that's why the safety is paramount. And in the vaccine centers, they're fully equipped to deal with anaphylaxis. And people who have this underlying problem, they are monitored closely for half an hour after the vaccine. If there is a true allergy to one of the ingredients of the vaccine, which is the lipid bilayer, then those individuals should not take the vaccine. So just in terms of side effects, because people have experienced, are experiencing side effects from the vaccine, and that's actually a good thing, because that means your body is ramping up and its immune response is developing so that you will be able to neutralize the COVID virus should you get it. There have been no serious side effects in the trials to date and the ongoing safety monitoring. The difference between the viral vector vaccines, the AstraZeneca Oxford, and the RNA vaccine, the Pfizer, not too much. I mean, arm pain is predominant, chills, fever, muscle aches, headache, fatigue, and the range here in brackets indicates the second dose, more arm pain, swollen lymph glands after the second dose of Pfizer, more muscle aches, more fatigue. Generally speaking, these are gone they start about 8 hours after the vaccine and are generally gone in 36 hours. If you can put off taking Tylenol or Advil, we think that you might get a better immune response to the vaccine itself, but really, if you're miserable, take the Tylenol, Advil. The good news is the older you are, the less severe the symptoms. So that in this slide, you can see that if with the Moderna, if you're older than 71 years of age, the first dose, very little problem. The second dose, a little bit more severe disease or side effects, and that would be the high fevers, etc. And similar for the Pfizer. The older you are, actually, the less the symptoms. So everybody wants to know, where am I in the timeline? And I'm just speaking to the Hawaii crowd at this point. So this is actually from the CDC. So healthcare workers in nursing homes are targeted as the most high risk and therefore the first in line for the vaccine. And now we're moving into the first responders, the essential workers, and the Kapuna, 75 years of age and older. And then the next phase are the 65 years plus and people with comorbid illness, and then finally the rest of the community. So this slide shows Hawaii. I think I can't remember how many doses have been rolled out, but we're way ahead of this now, double at least. So we're well into the essential workers, and we're now well into the 75-year plus, and the essential workers who are being invited by the state in a rolled out fashion to receive the vaccine. We're anticipating in March that the 65-year-old plus will be beginning to get the vaccine, and then in the summer for the rest of the individuals who are lower risk. However, these vaccines can be redistributed if there's an outbreak in a certain population and we need to bring the vaccines over to them. If we need to make sure that the people are getting their second vaccines, there will be a delay in people receiving the first vaccines. To get an appointment here in Hawaii, the best way is to get into MyChart. Anyone who's been seen at Hawaii Pacific Health can apply for a MyChart app, download the MyChart app and get an access code in order to book a vaccine appointment, and they will also be messaged when their turn comes up. Queens also got a MyChart platform as well to sign up for appointments. The Hawaii Pacific Health is vaccinating anyone who meets the criteria at Pier 2 by the Aloha Tower. They're also vaccinating in Kauai. I'm not sure about the rest of the state. I apologize. The non-HPH individuals, so these can be the rest of the state, can go to the hawaiicovid19.com vaccine sign up. Veterans can call this number. That's 0600. My apologies. And then the website that the Department of Health, anyone can go into this. They have phenomenally good information that's very clear and very up to date. So I encourage anyone to, even if you're from Canada, to look at that. And then they can also call because, of course, some people don't have access to the technology required to book appointments. Beware of vaccine scams. You can't skip the queue by paying money to get vaccinated earlier. So the big question is, when is life going to return to normal? And the emphasis is being vaccinated. If 75 to 85% of people in the United States get vaccinated, this outbreak will be over before the end of 2021. And this is where the new variants become of significance. If you've got virus percolating in the community, if you have someone who only receives one vaccine and doesn't go back for their second one, this gives this virus an opportunity to mutate. And these escape mutants are the ones who can come back to potentially infect us. Now, the UK variant is more infectious, but has not been shown yet to evade the vaccine, and it has not been shown to cause more serious illness, although that's being studied. The more concerning was South African and Brazilian variants. These are variants on the spike protein, which we've directed our vaccines against and some of our treatments. At this point, they do not seem to be causing reinfection with more serious illness, but this is being very actively studied, because if if they evade our vaccines, then we're starting from square one with having to create a new vaccine and re-immunize again. So what we want to do is vaccinate, 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 because if you stop the virus, whoopsie, from spreading here, you're going to stop the massive replication to uncontrolled spread. And this is where the viruses learn to mutate. If we can stop them from mutating, we will be moving forward to more of a normal life. But we need to continue our vigilance, particularly against these new variants, avoiding crowded situation, close physical contact, enclosed spaces, indoor restaurants without good ventilation, and being around people for a long time without masking. And so just there's been some information on the dual masking, wearing 2 masks. And as you can see, a cough will spread all these viruses or particles, and wearing a mask prevents some of that from being inhaled. This is an old study from 2013 that looked at viruses, and it shows how the various materials can prevent the filter out the virus, and the surgical masks being 89%. And now they're finding that if you wear a surgical mask with a cloth covering over top, you're getting about the same protection as these the N95 masks that we wear for protection when we're with COVID patients. So it is thought to be a good idea. Finally, I just want to talk about the worldwide vaccine access, because there's no such thing as a national solution to a global crisis. The variants are coming out of South Africa, they're coming out of Brazil. Therefore, there is a movement called COVAX, which is a coordination between the World Health Organization, the Global Alliance for Vaccines and Immunizations, and the Coalition for Epidemic Preparedness. They've bound together to allow or support global access to vaccines by pooling the purchasing power of low and middle income countries so that they can order vaccines and have their access to it. It's coordinating international resources for diagnostics and treatments as well. So the Coalition for Epidemic Preparedness are working on supporting research and development of vaccines, and India will be producing the Oxford AstraZeneca to be distributed worldwide. And the Global Alliance for Vaccines and Immunizations are helping with procuring vaccines for these countries and delivering the vaccines, along with support from the World Health Organization. And so the COVAX participants, you can see there are over 92 countries that are involved in this initiative. And Rotary is also involved because we're involved with the Global Polio Eradication Effort, which supports Gavi with funding, as well as having created a public health infrastructure in many of these low-income countries that is now being used for COVID, for recognizing, for educating, and hopefully for distributing vaccine to some of the most hard to reach and vulnerable populations in the earth. So just to conclude, you know, we're getting there. The light's at the end of the tunnel. We still need to maintain our good public health measures of avoiding gatherings, wearing masks, distancing. We still need to be able to identify cases, isolate them, vaccinate widely, and postpone for a little while. But we will get through this. Thank you.
Wonderful, Claire. Very good.
Okay, so I'd like to open it up for questions. I don't know if anyone's put any questions in chat. Maybe James or Naomi could.
Claire, I just wanted to read off some of the questions. I think first we have Laura Stillquist. She asks, if someone takes the Johnson vaccine now, is it safe to take on one of the other ones with higher efficacy later?
That's an excellent question. So the Johnson & Johnson is not yet approved. February 26th, the FDA is going to look at that as whether it's past the safety requirements. There has, at this point, the messaging is, if there's a vaccine available, get it. in future, as more vaccine becomes available, they will be looking at maybe giving someone a booster with one of the other types of vaccines that have been developed, like the viral vector vaccines, because that may prime the immune system in a different way. So they're actively studying that. But at this point, we have such a shortage of vaccines that anything that becomes available is better than nothing. So get whatever's available, because they have been proven to be safe and effective.
Thank you. We're trying to get our essential workers vaccinated, and I'm saying any vaccine that they offer to you, take it. Right.
Right, exactly.
And just to dovetail on what Claire mentioned, like she said in her presentation, getting the Johnson & Johnson vaccine, one dose, the single dose, is going to be a lot better than having someone partially vaccinated. So I think that's the key, is to not have someone who's taken the Moderna or Pfizer only once and only have that partial immunity. And the Johnson & Johnson single dose is going to be much better. And so just from a logistics perspective, I was just listening on the radio that, the problem right now is, withholding the first dose of vaccine right now with concerns of not being able to get the second dose. So there's all these logistical nightmares that people are unfortunately getting. My parents in Washington State are having the same issue. Thurston County, where Olympia is, they just aren't reduced. They have enough, but they just aren't releasing it because they're worried about the second dose. So I'm really excited about the Johnson & Johnson, and looking forward to, hopefully we'll get a lot of it here in Hawaii too, especially with a lot of transit population here that may not be able to get that second dose because they're traveling between islands or going back to the mainland, et cetera. The next question we have here
Can
is.
I just speak to the vaccine too? There's circulating in the media, there's this thought that the one vaccination by the Moderna or Pfizer will give you 80% immunity. So because of the concerns with, the second dose will give me more side effects, I don't want to get the second dose. But what that potentially sets us up for is we don't know how long the immunity from a single dose will last. And that's where viral mutants can also start to percolate. Because we're only partially vaccinated, we may pick up a virus, it mutates because we're partially vaccinated. So we need to follow the science, but there is now, the CDC is saying that you can get your second dose upwards of 6 weeks after the first dose, 42 days. Sorry, is that 6 weeks? 42 days, and it's still considered effective. So if you need, if it's not exactly on day 21 or day 28, it's still a effective vaccine.
Okay, great. Looks like our next question is going to be from Frank. Which vaccine is best for someone with thyroid problems? And on second question, how often do doctors plan to do a diagnostic test pre and post vaccine? And I could chime in on this too, Claire. I don't think there was a specific subset group of patients with hyper or hypothyroidism. It doesn't seem to have affected anything. I haven't read any literature on patients it causing something called thyroid storm, or it causing like the worst case scenario, something called myxedema coma. I haven't heard of any of these kind of life-threatening effects from the vaccine per se. But to actually not have someone with thyroid disorder, to have someone with thyroid disorder not get the vaccine probably would not be recommended. So our recommendation still from all lines of chains of command all up to the CDC, I think, would be someone with thyroid disorders should still get the vaccine. And secondly, how do doctors plan to do a diagnostic pre and post? How often do doctors do a diagnostic test pre and post vaccine? I don't think we do. We actually don't do any testing at all. If you are interested, though, however, in enrolling in a study, one of our Rotaractors at the Japsom Medical School, she's a PhD student in tropical medicine, Caitlin Druse, she's actually part of a study that's studying COVID, and she's actually trying to get people who've either been vaccinated or people who've had been infected to actually test kind of how long the vaccine will last for, potentially with some of this kind of implications in this question, Frank. So unfortunately, I don't have the answer as to what the recommendations would be if we were to have a test for this, but I could see, I understand where it's coming from. You want to know, hey, like how, especially afterwards. I know a lot of physicians that I know that were part of the initial trial actually got the antibody testing, just kind of checked them what their levels of antibodies were after getting the vaccine. And it was surprising that a lot of people were actually getting pretty high readings even after just the first dose. But with that said, no formal recommendations yet. I know that everyone is kind of wondering, just to kind of, the question is like, how can I tell if I'm vaccinated also? Will I be able to travel? Will my little, as Murray messaged as well, will the yellow the CDC that says I got the vaccine, will that be recognized traveling, will be recognized internationally? I don't know, and I think they will probably still want to do a test for you, like for pre and post travel. So it's hard to say. It's definitely not in an official kind of record of any kind that other than that little card that you carry, which is very similar to your other vaccination records, right? For yellow fever, making sure you have your shots when you travel internationally. So.
If I could just also add to that, the vaccine does not result in a positive nasal swab. So if you are positive after the vaccine, you actually have COVID-19 infection. And the study the study participants are being followed for 2 years. So they are going to be testing the antibody levels in the blood to see how long the vaccine is protective for. So we'll have more data as that stuff gets published as well. Oh.
It looks like our next question is going to be from, let's see here, from Shauna Cox. Do we know the accuracy of the new Assure COVID test yet? And honestly, I'm not familiar with that test. I don't know if maybe there's
there's two kinds of tests out there. The one that Biden administration has put millions of dollars towards manufacturing in the United States is actually one of the antigen tests that can be done at home as opposed to having to go to a center to have it done. So the antigen tests are not as accurate as the genetic PCR tests. They're very good if you are having a lot of symptoms. A positive result really is normally fairly accurate, but you can miss infections. The other one, the Assure that's being developed, is actually a different type of test completely that has been shown to be as accurate as the PCR testing in detecting COVID and can be done at home, but unfortunately it is still in the FDA approval stages, so more to come on that.
Okay. It says here from Adrienne King, Rotary Club of Waikiki. Can you send info on where, on how and where to get in the list? How will people know or be told where to get in line? So right now, there actually is no lines. We're not having any lines form up for the vaccine. There are, I think, Claire, if you wouldn't mind, Claire did have a pretty good slide as to kind of how to go about getting a test. There's a few phone numbers to call, or you can get online and actually request an appointment. And what they'll do is they'll have I'm guessing around 10 or 15 slots per appointment time for people to come and get their test. Their vaccine done. And right now, big test centers, repeating what Claire mentioned, are at Pier 2, just right across the street from Restaurant Row. And that's where Hawaii Pacific Health is holding their kind of mass vaccination center, I guess you want to call it that. And then the next site, which is actually at the Blaisdell Concert Hall, is where Queens Medical Center is hosting their mass vaccination site. And I think we could get that information in the chat window here in a little bit. Moving on to the next question. Let's see here. Patricia Nevada asks, will the virus travel through vents in buildings? I think that is true. It depends on if those vents have the HEPA filters or not. I think especially in the hospital setting, we definitely are worried about and Brian can attest to this too as well, being an ICU nurse and myself being an emergency physician, dealing with patients that are kind of, in respiratory failure, needing being on ventilators, needing certain types of aerosolizing procedures done. And by that I mean like intubating somebody, having somebody on we call a CPAP or BiPAP mask, where they actually can expel the virus out. So definitely yes, the answer is yes. So I think the key is to obviously make sure that your ventilation goes outside, and our exhaust actually is required to go up. I want to say at least 30 feet up into the air before it's actually expelled out, and it is technically pure, filter before it gets out as well. But thanks, Claire, for putting this up. If everyone can see this here, the easiest is going to be just, honestly, I believe the Queens should just be on their website. I believe just the Queens Medical Center website. Going back to the chat window here, Raz asks, is the second Pfizer vaccine the same composition as the first? And that is correct. The Pfizer and the Moderna vaccines, they're both the same. So you're just getting more or less the same vaccine twice, and that's just because, as Claire mentioned in her lecture, the mRNA that actually encodes that specific spike protein, your body just needs it again to make sure that it's producing it in your body. So that's just kind of the second the theory behind that. Let's see here.
Just there might be a little bit of confusion about the viral vector vaccine, AstraZeneca.
Okay.
So in their trials, they were looking at different doses, and it was interesting in that the one arm of the trial, they vaccinated with half a dose, and then the second dose was the full dose. And those individuals actually had a better immune response, upwards of 90%, versus the ones who had the exact same dose in both vaccinations. So they're still looking at that to determine what's the best rollout moving forward, especially as they immunize the large numbers of low-income countries. The other part about the viral vector vaccines is that they only require refrigerator temperatures. So we're familiar with getting vaccines to people in low-income countries without the same refrigeration abilities as we have. So these will be really, especially the Johnson & Johnson, will be a great vaccine for targeting many other countries.
Gotcha. And the next question we have here is from Murray as well. How up to date is the cdc.gov travel notices for each country? I just looked that up myself here at Murray, and it looks like the latest overall update was on February 2nd. So I would say, and I think that the last time I checked was for a Nepal trip, and I think that was maybe a week or two ago, and it looked like it was around the same time. So I'll let you know when I recheck it, but I don't know, there isn't an official message that says when they actually update it, but the most recent one was about 9 days ago. So it looks like they are, pretty much usual fashion. I think not much has changed in terms of regular vaccines. Obviously the COVID kind of atmosphere or climate has kind of changed things drastically in terms of travel, but once I get more updates on that, I'll let you know.
James.
Yes, Nancy.
This is Nancy. I just wanted to mention before we get too close to the conclusion, one of the purposes of doing these seminars is to encourage more people to come on and listen to accurate information so that it can be spread in the community. We currently know, although they say 91% of people in Hawaii have agreed to be vaccinated, I doubt those numbers. I think it's more like 30% are on the fence, 30% are on the fence, and 25% are not going to get it. So our job is to educate people about the safety, the efficacy, and the different vaccines that are available. So what I'm asking everybody is if each of you would invite 4 people or 5 people to the next one of these, that would be great. I mean, it's just like the slide that we saw of the one person spreading it to 50 people. So we could really make a difference as Rotarians by trying to get that 30% that are on the fence and get them into the vaccination and shots into their arms. Thank you.
Thank you, Nancy.
It looks like Lee Donaldson has his hand up. Lee, why don't you go ahead and ask your question?
Yeah,
Please,
thank you. Sorry, I'm having technical difficulties with my keyboard. They've been talking about UV lights and commercial settings. Can those box type UV sanitizers that you see in restaurants and kitchens be effective in small lunchroom environments? Or are they just sort of fluff and puff sanitizers?
No, so I think a lot of that has to do with flow, and I think you definitely want to actually get someone to actually do a full study of your airflow in your building or in your room that you're kind of questioning. Unfortunately, I don't have the exact formula or the answer to you for your specific size of space, but at our hospital anyway, we actually have installed those, and we definitely actually asked the same question, and the answer was yes, based on the amount of flow that we get and the amount of light, I guess, the amount of UV that's actually emitted. So I think, I think depending on your room, depending on how much airflow is going through, yes, those can work.
Thank you.
I just wanted to comment on Frank's information here from that he put on chat. He mentions about a hydrophobic coating of HVAC filters to mitigate airborne pathogens in buildings using air filters. So that might be another option for people.
Oh, Greenwells, go ahead.
Okay, go.
I've got just a couple of quick questions. We've had the first Pfizer vaccine. My question to you is, or anyone, is how do we know that that vaccine has been stored at the correct temperature so that we will then benefit from the vaccine itself?
I must admit, I have not been involved directly with the vaccine efforts, but certainly I know every Thursday we get a shipment of the vaccinations from the mainland, and they're stored in the special containers that Pfizer has developed to ensure safe storage. And then they spent a lot of time before they started the vaccination programs looking at how to safely store it here in Hawaii before getting it into the arms of people. And once it's unthawed, you have a certain number of hours to get the vaccine into people's arms. And they're trying not to waste any vaccines. So if people don't show up for appointments, they will offer it to someone else towards the end of the day. So we utilize all the vaccines.
My next question is that I have friends on the mainland who have just had their second vaccination, and they are thrilled that within 2 weeks they will be able to travel. My concern is, and I know we were given information passed out to us after we had the Pfizer, how many people really read information that you're given? My concern is, I feel when you are vaccinated, verbally you should be told you're not scot-free, that you should still follow the rules and regulations. And my concern is, in this handout, it says that the Pfizer vaccine has been shown to prevent COVID. My understanding is to prevent you, should you get COVID, to have a lesser case and perhaps avoid death.
So this is with the fine line between being a viral carrier and getting the COVID disease. So COVID versus SARS-CoV-2, right? We use that kind of interchangeably, but so you can still be a viral carrier, but you may not show the disease elements of that virus. So that's why it's important to still wear a mask. You can still transmit that and carry it. The good news is that with the Pfizer as well as the Moderna, there have been 0 deaths from hospitalizations from COVID-like symptoms after patients who've received the Pfizer or the Moderna. So that's actually, that's there. It's not going to prevent you from getting cold symptoms per se, right? But you're not going to die from COVID, after getting the vaccine. So that's a breath of fresh air. To just to kind of go back to the vaccine delivery itself. I actually was able to personally go tour the at Wilcox Hospital in Kauai before they had the rollout, as well as the kind of vaccine storage kind of areas at Straub as well. Man, it's lock and key. It's like a military kind of setup, and and I can't speak on behalf of the other places, but just me personally seeing how they have this timed. They have like 2 or 3 people that are woken up in the middle of the night just to check to make sure. Everything's on alarms. Everything is, security is well aware of this. So it's just FYI to give you some reassurances, at least in our facility at HPH. They definitely run a pretty tight ship. I kind of joke, and I swear I feel like they spend more time guarding the vaccine than they do guarding the staff that work there. I feel like, but anyway, it's good though. It's good to let the public know that that we're definitely making sure that vaccine is safe for everybody.
I'd just like to also just comment on the Moderna and Pfizer. The natural infection passes through our nose passages and then into our lungs. And so the vaccine is injected into our arms. And the studies that show the 95% efficacy is against the COVID illness, so the lung illness. But because it is an injection through our arms, they don't feel that, we don't know yet if it will also neutralize enough virus in our nose passages to prevent us from spreading it to others. So does that mean you have the disease because it's percolating in your nose? I don't know. I think COVID-19 disease is more the lung infection and the sequelae from that. So yeah, it's incredible how effective this new vaccine platform is actually in terms of preventing the COVID-19 illness. However, it's 95% effective, not 100% effective. So 5% of people will not be prevented from getting the COVID-19 illness, even though they're fully vaccinated. And so we don't know who those people are. And therefore, it's not safe to travel without using the proper mitigating strategies.
Thank you.
I don't see any other questions in the chat box. I just want to see if anyone else wanted to raise their hand or just jump in the screen and make a funny face so I could call on them if you have any.
Can I just ask something? Do we know why people are vaccine hesitant? The 30% on the fence? Can anyone speak to that? Yes.
Go.
Am I muted?
No, you're not.
No.
Okay, I think because it's an extremely new vaccine that people are very hesitant as far as repercussions down the road of receiving this vaccine. I think the problem is the right hand doesn't know what the left hand is doing, in real layman's terms. I used to be blonde. But they don't, if everyone would agree on procedure, agree on the importance of it, there's a lot of information that's coming out on the internet that from doctors that you see it and you go, are you kidding me? I am not going to get this vaccine.
Mm-hmm.
The younger generation is very concerned about their teenage kids and infertility and repercussions of what is in the vaccine for these young kids down the road. I'm 76. You know what? We are where we are. And my husband will know, and my dear Nancy will know, it took me a while to get this vaccine, but I did it. And I will also say that Jimmy and I both have had COVID. So this has been a real eye opener for us. And it came out good, but
I'll just add one other thing too, having both had COVID recently and gotten through it with varying degrees of symptoms and very, very different. There was very conflicting information we were getting from people in the medical profession in terms of how soon after you have had it, it's appropriate to get vaccinated. Is 2 weeks out, or should you wait 90 days or longer, and the pros and cons. So for those who have had it and are questioning whether they should step up now or wait to get it, there's conflicting discussion within the medical community.
and it's very hard because you, the individual, like any medical problem, you have to make your decision. I will say Queens and the Department of Health were unbelievably fabulous.
That's great.
Fabulous.
If I could add one more thing, hi Claire. And this is beyond just this particular vaccine, but if you look at the work that's done by Pew Research on people's attitudes towards scientists and towards the so-called establishment, particularly in groups under 50, the trust in the US government right now is 17%. And a lot of people, I mean, that's probably one of the biggest things going on in the States. It's a lot higher in Canada. But if you don't trust the government, you don't trust the scientists, you don't base your feelings or your views on facts and instead on emotions, and then somebody comes along with a really good tweet about how this virus is going to do whatever to you, that's a big factor in a lot of it. And they're finding it across the board, whether it's measles or whatever.
Yes.
So I guess what we need to do is just try to reach out and address some of the questions and support the need to try to get back to normalcy by shutting down the virus.
And am I muted? I also, correct me, feel that this is not like a polio vaccine or a typhoid vaccine that really does prohibit you from getting COVID. I think people are a little concerned with that.
I think too, with our experience with the flu vaccine and the
Yes.
fact that, every year they don't get it right and
Yes.
we're never fully immunized. That is one of the potential concerns. The
Yes.
research, though, has really shown that even people who have had COVID-19, the immune response to the vaccine when they follow antibodies is higher than to people who have had mild COVID illness. And so that's why the promotion of getting a vaccine even after being immunized. Having said that, they do feel that 3 months out is a good time to get the vaccine because at this point, the science seems to indicate you do have antibodies for at least 3 months out. And that's the other thing about for individuals who do get the monoclonal antibody infusion, there's absolutely no point in getting the vaccine for 3 months after a monoclonal antibody infusion because it's meant to neutralize virus. So it's going to neutralize any of your vaccine or your body's response to the vaccine too. So it's at least a 90-day wait after a monoclonal antibody infusion. And just one other thing I did not mention. People generally, after 10 days of symptoms, they have cleared the virus. And as long as they don't have fever and their symptoms are improved, they are allowed to sort of come out of isolation. But if you have an immunocompromising disease, and that can include diabetes or severe illness, it's 20 days before you're cleared. But that's where the health unit in conjunction with your primary care provider provides guidance.
Am I on mute?
I want to share a situation with my veterinary practice. So we had access to vaccine on Kauai early as frontline workers. Out of my 10 employees, they're a younger group, only 2 got vaccinated. I offered $100 for each of them to go get vaccinated and pay their wages for waiting in line, and they still refuse. So
Oh my
because they have a low stress or low level of worry because they're young, I worry for the general population when it's time for the young people to get vaccinated, they may not step up.
Mhm.
I think I saw Shauna had her hand up earlier. Shauna, are you still interested in asking a question?
Yes, sure. I actually I had a couple. I wanted to speak. Thank you, Mrs. Greenwell, for speaking sort of on behalf of those of us who are hesitant on getting a vaccine, because I myself am one. I am a frontline healthcare worker, and I do not have trust in any of. I'm very on the fence. I'm still doing my research. I haven't yet made up my mind, but there are so many things that is cause for concern in my opinion, and that's why I wanted to get on, because I wanted to, research on both sides. I just don't only want to hear opposing opinions as to why not, get the vaccine. I also, I want to be educated when I make my decision. So thank you, everybody, for that. My other question was in regards to vaccine supply and demand. So it's my understanding, because we got a notification through HPH, it's my understanding that the supply, there's a delay in receiving supplies for vaccines. So what they're doing now is they're putting the phases on hold in order to be able to give the second dose of the vaccine to the people who already received the first dose. That was my understanding when I got the notification. Dr. Schnarr, have you heard or seen this?
So what's happening is that, like, for example, they did not get as much vaccine as they had hoped on Thursday's shipment. And so they are prioritizing people who need this is in Hawaii, prioritizing people who need their second dose and rolling it out to those individuals. In fact, they had to borrow from the Big Island in order to immunize here at Pier 2. And now that the CDC has given us some latitude in terms of vaccinating a little bit later, and it's still being considered effective, that is going to be helpful. But that's why there have been no appointments available for individuals to get their first vaccine in the upcoming week, because they're prioritizing those vaccines that are being received for the people who need a second dose. James, did you want to comment on?
No, I just personally have had issues, like I mentioned earlier, with trying to get my parents vaccinated in Olympia, Washington, and same kind of thing. They actually off the bat went down to 65 and trying to capture it, and they also went straight up with like private pharmacies like Costco and Walgreens, et cetera. And again, I think they overextended themselves, and I think that's the problem is that once you kind of roll this out, you can't really hold back, and these delays unfortunately are affecting things because everyone now goes and assumes that they're ready in line to get vaccinated, and it's not there. So that also adds some concern of kind of distrust with the government, distrust with the system, right? And just kind of just like people who've spent all this time and energy to kind of to kind of come up with this decision. I'm finally gonna get vaccinated, right? And then, like, my parents are in the kind of same boat. They're very hesitant to get it. Finally made the decision, and now that they're ready to go, it's not available, and we don't know when it's gonna be available. So now they're just back on the fence again. They're just like, well, why should we? We're just gonna stay at home. We'll just kind of be hermits again, and not interact with anybody, and just do our thing, and we'll just kind of spend our time, Anyway, so it's just frustrating on my end, and I totally see the sentiments. So specifically, as someone who's trying to advocate for the vaccine, it's hard to see that. But yeah, I would say I would say maybe I think the state of Hawaii is a little bit more kind of systematic, I would say, in the sense of not just having it roll out all at once and having it at 75 first and then kind of slowly getting it down. And, again, I think there's a lot of frustrations with that, from this bigger bureaucracy trying to kind of command kind of what's, how we get this. But in a way, it's kind of nice too to know that that there's actually a thought out plan instead of just this, let's just give it to everybody, then we don't have enough, let's just stop it. So I think, it's hard to say, but yeah, Sean, I totally understand your concerns. I do have a lot of friends that, I'm on get messages all the time about specific questions. And I think the more and more sessions we have like these, and hopefully more Rotarians, and just like Nancy mentioned, more friends we could bring to these conversations, I think is going to be key, because even just sharing with like-minded people, forget the physicians and the people that are kind of giving the kind of the expert advice, I guess. Just even sharing the talks with Mr. and Mrs. Greenwell, right? The Greenwells, I think that was a very key. Thank you for sharing that. And I think those experiences, I think, are going to help us kind of get people more informed and kind of hopefully, just going back to this with Rotarians and the whole polio plus, the plus part is other vaccines, right? So just kind of, as Rotarians, kind of understanding that, and now that we're not worrying about vaccinating people in Afghanistan and in Pakistan, we're actually vaccinating people right down the street. So I don't know to what extent Rotary is going to be formally getting involved in our communities, but we do know that Rotary has taken a stance to kind of utilize, like Claire mentioned, the polio kind of channels that they've created to actually improve and hopefully get the whole world vaccinated. So I'm super excited about that. But again, the challenges are there. Hopefully we could get more more sessions like this. And again, Shauna, if you have other friends or other healthcare workers who actually are on the fence as well, we want to know why. We want to hear their experiences. Why our Straub ER is only 70% vaccinated. And so the other 30%, we're trying to figure out why. We're not trying to ostracize them. We're not trying to. We just want to know what are the. Sorry for all the noise. My kid's having a play day here, but what are the barriers? So, and how can we help? So I think I definitely appreciate the feedback, and and if you're interested, Sean, as well, we are having this district health service committee, and if you're interested in joining that committee as well, please let us know, because we definitely want we want the voices. We want actually a broad range of Rotarians kind of helping us with this. And it's not just gonna be COVID too. There'll be other health topics. Just COVID right now is the biggest topic we're discussing. Trying to think of any other questions or any other.
I have a question.
Yes, please.
This, I think, will help you all as well. We are in Kona, and we have wonderful local people that are creating fences, Mauka of us, and they came down in their ATVs, a group of men, and we were talking with them. Jimmy and I both born and raised here, and we said we're walking, and we're really good. And we talked about COVID, and we said that we had contracted COVID. And the driver of the ATV looked at me and said, "Auntie, so COVID is for real." So that's another thing that I believe needs to be addressed. I don't, that's case in point right there, where people do, and I think the trust between the government and whatever else, unfortunately, isn't where it should be. And so this is the comments we get.
No, and that's a great point. And same thing with me, honestly, working in the emergency department. It took me a while to actually see it here in Hawaii. I think a lot of us, we definitely were kind of on the kind of the, I would say, the 2 or 3 week delay, I guess, as opposed to the mainland. We actually never really got our full surge that they received first in New York and then across the nation all the way to most recently to the West Coast, right? And we're prepared for it, but honestly, you're right. Like a lot of my friends in California, same thing. It wasn't real for them until they were neck deep in it, until the clinic docs are working in the ICU. stressed out. And and again, I totally agree with you. And I think the reality of it needs to happen. And I think the more people we have more Rotarians that we have who are survivors of COVID and who could actually talk about it. And we definitely appreciate you. And I think definitely at the start of it all, I believe we did have a couple of members reach out with some surveys or whatnot. Maybe we need to re-engage those surveys again and to get those voices heard. Because thank you so much for that comment and discussion about that. We have some more chats. I agree with that as well, Naomi. Religious beliefs actually are there as well. There definitely are concerns, especially in certain populations, whether or not the product is human derived or not, whether it's animal derived, whether it's how it's originated, things like that. So there definitely is a concern for that as well. And also just certain religions also, just don't have the practice of vaccines, right? So I think we need to be cognizant of that as well, and also get those voices heard, and also then how do we take measures to protect those populations without vaccines, right? So I think there's definitely ways around it. It's not a binary system where you're either for us or against us, and unfortunately our society has become more divided and bipolar, I guess, in that sense. And I think as Rotarians, we need to just keep driving the train, and regardless of what our political kind of views are, regardless of our jokes and comments, we just need to kind of unite. And I think this is a great way to do this. And some comments just to talk about what our discussions are in the Health Service Committee. I think Claire mentioned the Native Hawaiian Pacific Islander population in Hawaii being hit the hardest. Both in terms of the extent of the disease, but also just the percentages. I think we're definitely looking for outreach into those communities, and I think that would be our next advocacy, I guess, for populations in Hawaii. Not only the elderly, not only the healthcare workers, the educators, et cetera, but then how do we drive the train towards reaching these targeted populations? So again, we're hoping to have a conversation with Lieutenant Governor Josh Green. We're still kind of waiting for him to get back to us. I know he's a busy guy, but we may just look for other channels, other ways to kind of get this involved, and also how do we develop programs or projects, especially for the upcoming Rotary year. I think starting in April or May, people will start wanting to kind of come up with ideas and all that. Most recently, there is, if you want to talk to your club's community service chairs, I believe, Naomi can maybe speak on this as well, but there definitely is additional funding from the district for COVID-related projects. And I think there's definitely some grants available. I believe there's one per island, one per county, that's up to $5,000, I believe. And that could be that's a joint project between clubs. And I believe individual clubs could also apply for a $1,000 COVID related projects too. So how do we kind of come up with projects to kind of help either with vaccination, either with awareness, whether with education, with other ways to kind of help solve this, because and knowing very well that there may be people who don't want to get vaccinated or can't get vaccinated, and we have to kind of find ways to still mitigate those risks and work with those people as well.
Well, I think, we've gone a little bit over time. I think we should wrap up for today. Thanks everyone for coming. I think sharing our stories is an excellent way to address concerns, find out what people are worried about, and perhaps our next Zoom, we might bring in people like the Greenwells to talk story and share facts around those stories. Again, thank you for coming, everyone. And I hope you enjoy the rest of your weekend.
Thank you.
Hello.
Hey,
Thank you very much. Excellent.
Excellent. Thank you.
thanks, Claire. And James?
Thank you, everybody. And thank you, Shauna, as well. Thank you.
Thank you. It was fantastic.
Thank you for allowing me to be part of this. It was informative. I appreciate it. Have a great day, everybody.
You too. Thank you.
Leave. How do you leave?